I am now pleased to introduce our first speaker, Dr. Cecilia Spitznas, Senior Science Policy Advisor in the Office of National Drug Control Policy, which is part of the Executive Office of the President. She provides policy analysis and scientific advice to the ONDCP Director and Chief of Staff on special matters of concern such as emerging drug trends and demand reduction, and helps to develop legislative responses to problems of national scope, particularly on opioids and prescription drugs. With the President's recent announcements on new public and private sector efforts to address the prescription drug and heroin epidemic, this is an incredibly busy time for her office, so we're honored that she's with us today. Cece?
Thank you, Catherine, for that kind introduction, and to NIHCM for sponsoring this event. I'm going to be talking today about federal initiatives for prescription opioids and heroin. In 1999, there was one drug overdose death every 30 minutes. In 2013, there was one drug overdose every 12 minutes. In addition to our concern about overdose, there are other medical consequences such as substance use disorders and the development of neonatal abstinence syndrome that are of concern. This slide illustrates the change in neonatal abstinence syndrome from 2000 to 2009. This is a syndrome that many babies who have been exposed to drugs during pregnancy experience following birth when they withdraw from medications and from illicit drugs. The change in NAS in 2009 to 2012 was also pronounced. The NAS incidence increased from 2.4 to 5.8 per 1,000 births. On average, this is one infant born every 20 minutes in the United States with the syndrome. The highest prevalence of this problem is in the southern states, followed by New England. And these infants are causing increases in the cost to both hospitals and state Medicaid programs. Our office, the Office of National Drug Control Policy, is a component of the Executive Office of the President, and we coordinate drug control activities and funding across the federal government. By statute, we engage in three primary efforts to guide drug policy. We develop the National Drug Control Strategy, which is a document that sets forth a comprehensive plan each year to reduce the availability of drugs and the consequences of drug use in the United States. We develop a consolidated National Drug Control Program budget for federal agencies to implement the strategy, and we coordinate and oversee the implementation by the federal drug control program agencies of the policies, goals, objectives, and priorities established for the National Drug Control Program and the fulfillment of the responsibilities of such agencies under the strategy. The National Drug Control Strategy includes the President's science-based plan to reform drug policy. One element of that is preventing drug use before it ever begins through education. A second one concerns expanding access to treatment for Americans struggling with substance use disorders. Third includes reforming our criminal justice system, and the fourth includes supporting Americans in recovery. The 2010 National Drug Control Strategy included three signature initiatives that are definitely still of concern today. The one I will be talking the most about today concerns prescription drug abuse. And in 2011, we went on to develop a prescription drug abuse prevention plan. Now, some opioid use relevant elements of the 2010 strategy included early intervention, treatment and recovery, and family-based treatment. And the family-based treatment is particularly important for helping pregnant women, women who have just given birth, to be able to deal with their substance use disorder. We also included naloxone for first responders, including law enforcement. Naloxone is a tool that can be used to reverse an overdose from an opioid. And we also included support for syringe exchange services in that 2010 strategy. Now, in 2011, we wrote a standalone plan, the Prescription Drug Abuse Prevention Plan, and that coordinated efforts across the federal government in four focus areas. The first is education, and we're largely concerned about prescriber education in that initial pillar. The next one concerned prescription drug monitoring programs and trying to expand the number of prescription drug monitoring programs that were available in the United States. Each state currently, except for Missouri, now has a prescription drug monitoring program, and we're working on trying to expand interoperability between states and also interoperability with existing electronic health records so that providers can use these as tools to check on and monitor their patients. We are also interested in improving storage and disposal of medication, and a fourth pillar of this was enforcement of existing laws and expanding laws and policies to help monitor overprescribing of medications. Now, obviously, there's a number of different things that can be done related to some of the consequences that we're starting to see from this problem. We're very interested, obviously, in the non-medical use of prescription drugs and the diversion of those drugs and trying to prevent that. We're interested in overdose education and naloxone distribution because we think that those are some good ways to try to turn the tide on overdose. We're interested also in earlier treatment as prevention. Obviously, it's a lot less expensive and can result in a lot better patient outcomes if people can be treated before they start to inject or before they start to use heroin or exposed to fentanyl, and fentanyl is a growing threat that we're seeing. Obviously, we're also interested in public health prevention interventions for hepatitis C and HIV. And one of the things that we're very interested in is expanding access to medication-assisted treatment for opioid use disorder, as well as maternal and infant best practices and establishing those to help to deal with NAS. So as Catherine mentioned, I think earlier, President Barack Obama visited a treatment organization in West Virginia and held a community forum last week. And this is just a quote from him. It touches everybody, from celebrities to college students to soccer moms to inner city kids, white, black, Hispanic, young, old, rich, poor, urban, suburban, men and women. It can happen to a coal miner. It can happen to a construction worker, a cop, a woman who's taking painkillers for work-related injury. It could happen to the doctor who writes him the prescription. And here's a photo from the forum, and the lady to the right was chosen as a representative for all of the parents who have had this type of experience. Director Botticelli and Secretary Burwell both attended this forum, and if you're interested, the White House YouTube channel has a video of the event. We were very happy that the President took time out to come and talk about this. As part of the activities, we released a fact sheet that's on our website and a presidential memorandum to address prescription drug abuse and heroin use. And the purpose of this was really to help reduce prescription pain medication and heroin-related overdose deaths, and to promote appropriate and effective prescribing of pain medications and increase access or improve access to treatment. So there are several components to this memorandum that I'm going to talk about, and essentially what this is really focused on is trying to make sure that we in the federal government are doing everything that we can to make sure that our agencies and policies are aligned to support the goals of the National Drug Control Strategy and the Prescription Drug Abuse Prevention Plan, and also the Secretary Burwell's Opioid Initiative, which Grant will be talking about. So a big component of this involves training and ensuring that the executive departments and agencies provide training on appropriate and effective prescribing of opioids. So all employees who are healthcare professionals who prescribe controlled substances as part of their federal responsibilities and duties, and contractors who spend 50% or more of their time under contract with their federal government prescribing controlled substances and as well as clinical residents and other trainees who spend 50% or more of their time in clinical practice in an executive department or agency facility will receive training on safe opioid prescribing. Also, as part of this memorandum, agencies that directly provide healthcare services, contract to provide healthcare services, request or reimburse for healthcare services, or facilitate access to healthcare benefits are being ordered to review their health benefit requirements, their drug formularies, program guidelines, medical management strategies, drug utilization review programs, and other relevant policy tools and strategies. And the review will also identify current practices that are inconsistent with the goals of reducing opioid use disorders and overdoses. Action plans that address barriers and practices identified in the reviews are going to be developed and submitted to the directors of the White House Domestic Policy Council and ONDCP, our agency. So this will include federal health care plans for federal employees and their families, and we think that this is a very helpful and important potential initiative. In addition, the President made a number of announcements that appear in this fact sheet that is referenced at the bottom of this slide, and these concern federal actions that federal agencies are going to take, things that are going to be in the 2016 budget, as well as state and local and private sector commitments. And I'm not going to go through all of these, but I'm going to go through a few of them just to give you a flavor of what we're going to be trying to do in the next few years. So the Department of Health and Human Services is going to undertake a review of how pain management is evaluated by patient satisfaction surveys, which are used in hospitals and by other healthcare providers, including a review of how the questions these surveys use to assess pain management may relate to pain management practices in opioid prescribing. CDC is going to invest more money on development of tools and resources to help inform prescribers about appropriate opioid prescribing, and I'll let Grant talk about that a little bit more. HHS is launching hhs.gov/opioids as a one-stop federal resource with tools and information for families, healthcare providers, law enforcement, and other stakeholders on prescription drug abuse and heroin use. CMS is going to release an informational bulletin to states by the end of the year on steps states can take through their Medicaid preferred drug lists and other utilization management mechanisms to reduce the risk of overdose. This is going to include a recommendation that they consider removing methadone for pain management from their preferred drug lists. And the Department of Veteran Affairs will lead a research initiative to evaluate non-opioid alternatives to pain management. The White House is going to host a Champion of Change event this spring to highlight individuals and communities across the country who are leading the fight to respond to prescription drug abuse. And we have a number of initiatives that are related to working in the community to prevent opioid overdose and respond to it. This includes that the Department of Justice and 49 states will have established prescription drug monitoring programs. I mentioned that earlier. There is going to be a number of 2 more take-back days that are going to be hosted by DEA. Looking for ones that are very relevant to you. HHS has recently awarded $11 million in new grants to states to support MAT and $1.8 million to help communities purchase naloxone and train first responders. And this fall, CMS will be testing 3 new Medicare prescription drug plan measures designed to identify potential opioid overutilization with the goal of proposing publicly reportable measures for Part D plans next year. These are just a few examples of things that are being done as a part of this initiative. We also announced a number of different public affairs types of activities that private agencies will be doing. For example, Google and the New York Times will be doing some additional media campaign types of activities. So I would encourage you all to take a look at this information on the ONDCP website and to take a look at the fact sheet, because I think that the fact sheet has a lot of real specific concrete examples of what you might be interested in as far as these new initiatives are concerned. And with that, I'm going to turn it over to Grant Baldwin.